It's time to rethink how you apply your acne treatment. Different Gel is more than a spot treatment. Research has shown that in those who suffer from acne, inflammation builds around the hair follicle well before you can even see acne on the skin. So I think compliance with especially creams, topical medications is a struggle, because in order for the medicine to work, you have to use it the right way. For a retinoid like Different to work, you need to use it consistently. Not just when the acne is there, but also remember, we're trying to prevent it as well. A moisturizer can be applied after if you are prone to dry skin. Even if you don't have dry skin or are not prone to dry skin, you may get dry skin when using Different Gel. Adapalene is a photostable molecule, meaning it will not break down in sunlight, so there's an option to incorporate Different Gel into your morning regimen. If you are going outdoors or to a place where you are getting direct sunlight, use a sunscreen as labeled. I think a big mistake both consumers and even patients make is that they'll stop their medication after they see clearance, after the acne goes away. In thinking about what acne is as a chronic disease, that just does not work. We don't only want to clear the acne, we want to prevent future breakouts. So continuing to use a retinoid like Different after the acne is gone is only going to make sense. It only is going to help you prevent those future breakouts. Different Gel is able to clear and prevent acne, which helps restore skin's natural tone and texture.